My name is Dr Vinay Bhatia. I am a consultant cardiologist at Maidstone and Tunbridge Wells NHS Trust. I also practice at the Spire Tunbridge Wells Hospital, the Nuffield Hospital in Tunbridge Wells, and the Wells Suite at the Tunbridge Wells Hospital. I grew up and went to school in Kent. And I did my training in medicine at Guy's and St Thomas's Hospital in London. After that, I did a PhD research in vascular biology at Imperial College and Hammersmith Hospital. I then did my training in cardiology, mainly in the Northwest Thames area, including hospitals such as the Royal Brompton and the Hammersmith Hospital. And I was appointed consultant cardiologist at Tunbridge Wells Hospital in 2009. I chose cardiology as my final speciality because I found that when I was training in it, it was the one speciality where there were huge developments that were occurring in how we could diagnose and actually effectively treat several cardiac conditions. And it was quite unique in that time period. I'm talking about in the late 80s into the 90s, and then in the last 10 years, there have been so many technological and pharmacological treatments that have allowed us to effectively treat so many cardiac conditions and to cure some of them. And in addition, the technology has improved in terms of how we can diagnose heart conditions. That's the aspect of it that drew me to it the most. That because as a doctor, you've got to think of what you want to do for 20 to 30 years, and I just felt that doing something where I could effectively diagnose and treat conditions would be rewarding and would help to maintain motivation throughout my career. I think from the feedback and the very kind compliments that I've received over the years, what my patients most appreciate is time given to them to tell their story, to tell the symptoms that they've been experiencing and how it's affected their lives, to be taken seriously, and they've also appreciated when I've tried to go the extra mile in terms of getting their tests done quicker, getting clarification for their diagnosis, and most importantly, moving their management on as quick as possible so that they get their procedures done in a very timely fashion. And it's always very rewarding to see them at the end of that journey when they've had a really good outcome and they feel better in their health. They deeply appreciate the whole experience of the journey, and in particular the effort that not just myself but the team around me make in order for things to move very efficiently. The most rewarding aspect is the fact that I work in a speciality where we can offer so much in terms of trying to diagnose heart problems and then to treat heart disease. I actually, as opposed to other specialities which deal with conditions which are very long term and degenerative and in some respects incurable, I think in cardiology, although there are some cardiac diseases which still are proving very challenging to treat, there are more where we can definitely improve the quality and longevity of patients' lives, and that is extremely motivating and rewarding to me.